Welcome to Kirksville, Missouri, a community that offers the best of both worlds, small town values with city amenities, and home to Moberly Area Community College. I would like to introduce to you the narrators of this story. Hi, I'm Miriam Hope Sal. I'm a pharmacy student at the University of Florida.
Hi, my name is Priscilla. I'm a public health student at Florida State University.
I am Ruth Jean Pierre, a second-year graduate student in the Salisbury University Master of Social Work program.
We invite you to hear JT's story, a young man who sustained an injury, and how his dedicated care team prioritized his recovery through seamless communication, collaboration, and commitment.
The emergency room physician quickly assessed and stabilized JT after his car accident, addressing both his medical needs and personal concerns. Acknowledging JT's fears about his injuries, career, and finances, the physician took a patient-centered approach. Noting JT's hearing impairment and jaw pain, they arranged support from a speech-language pathologist and social workers to improve communication and assist with recovery logistics. This interprofessional collaboration ensured JT's physical, emotional, and financial concerns were prioritized.
The nurse was instrumental in JT's recovery, advocating for his well-being. She monitored concussion symptoms, coordinated imaging, and managed pain and swelling from his jaw and shoulder injuries. Since eating was difficult, she worked with a dietitian to create a liquid nutrition plan for his healing and muscle retention. Noticing JD's emotional distress, she referred him to mental health services. She also took the extra step of facilitating a time where JD could visit his friend, Cassie, who was also hospitalized.
Social work contributes to the care of the patient by ensuring that the patient understands the condition for which they are being treated. The social worker evaluated the patient using the multi-axial system, determined his needs were primarily psychosocial and environmental, and proceeded to connect him with financial, social, and emotional supports he would need during the course of his recovery. She contacted the school to confirm insurance. Additionally, she reached out to the Northeast Regional Health Council for resources to cover his unmet need. She connected the patient and the family to mental health resources available through the hospital and within the community. She connected the family to the Chariton Valley Association for Housing and Support Services to care for his younger brother. She included the family in the recovery plan, directing the family to supportive community resources that could assist them and improve family outcomes.
The dentist played a vital role in JT's recovery, treating and evaluating his oral injuries while coordinating with the physician and athletic trainer. Considering JT's recent concussion and the risk of drowsiness affecting his schoolwork, they opted for an anti-inflammatory over an opioid through a shared decision-making approach. To ease JT's anxiety, the dentist used digital imaging to show potential restorative outcomes and connected him to a maxillofacial surgeon at the local dental school, providing reduced cost treatments. This collaborative effort ensured JT's recovery while also addressing his physical, emotional, and financial needs.
Speech-language pathology provides care in the areas of communications disorder, swallowing concerns, endeavoring to improve communication and enhance function for the patient. Speech-language pathology assessed the patient and noted that the patient had limited range of motion in the jaw, pain when masticating, and muffled speech. They worked with the patient and determined that it was best to make a referral to the Truman State University Speech Hearing Clinic for necessary follow-up care, as it would be most convenient for the patient and would allow for minimal disruption to current coursework. Speech-language pathology will follow up with the school for a baseline evaluation of the Montreal Cognitive Assessment Test that the client reports having taken before.
The occupational therapist helped JD regain function and independence in daily activities and training. To improve coordination and mobility, they designed sports-specific therapy and adaptive exercises to maintain conditioning. They also restrained JD's fine motor skills for shooting and dribbling. Collaborating with a sports psychologist, they reinforced mental resilience, while virtual reality rehab allowed JD to practice on-court movements safely. To ensure continued progress, they provided a home exercise program for recovery beyond therapy.
Physical therapy is an essential member of the care team, and they work to improve patient movement and function following an injury. PT assessed the patient who reported that there was pain upon opening the mouth. The need for continued therapy was emphasized, as was the need to steadily increase range of motion as tolerated, working on prescribed exercises at home. The patient reported that he was worried about his sibling who suffered from cerebral palsy, so PT made a referral to the social work team, as the circumstance is resulting in added stress for the patient, which may result in poor outcomes in his physical therapy.
Athletic trainers prevent, treat, and rehabilitate sports injuries, but JT's trainer went beyond the basketball court. After the social worker contacted him, he visited JT in the ER and later conducted a post-discharge assessment. When JT reported feeling sluggish and sensitive to light, the trainer recognized signs of a possible concussion and referred him to a neurologist. He also coordinated follow-ups with a dentist for JT's missing tooth and an orthopedic surgeon for his shoulder. By listening to JT's concerns, he ensured timely care and a comprehensive recovery plan.
After his concoction, JT struggled with noise sensitivity, balance issues, and brain fog, making daily life and training difficult. The audiologist conducted testing to assess hearing and balance issues. He guided JT in managing sensory overload in places like classrooms and stadiums and encouraged concentration exercises to combat brain fog. Collaborating with academic support services, they arranged accommodations like noise cancellation headphones and extended exam times. Additionally, they introduced music-based therapy to improve focus and reduce stress. Over the following weeks, they monitored JT's progress.
JT's journey highlights that health and illness exist on a continuum. His care team worked together like puzzle pieces, addressing his injuries while guiding him through lasting health. Through communication, teamwork, and a holistic approach, they ensured that his recovery was not just about treatment, but about restoring balance and well-being. Thank you for listening to JT's story.